Well, here we are again, Wound Care Workbench, everyone's favorite segment of the wound wire. Sharon gave us an excellent presentation on the assessment of pressure ulcers. And today in the Workbench segment, we're going to be taking that to the next level. We're going to share with you an exciting novel technology, wound rounds. This device is handheld, performs at the bedside, and aids you in the assessment of wounds, not only pressure ulcers, but all types of wounds. Now, what we're going to do is we're going to go live to Bronzeville Park, the Skilled Nursing and Living Center in Chicago, Illinois, to look at the wound rounds device and how it is implemented in a real patient care setting. Sharon, take it away.
Why don't you tell me a little bit about the device?
Okay, well, this is the Wound Rounds PDA system where we actually go in at the patient's bedside and assess the wound. We're able to take a picture of the wound, input the measurements and documentations right there at the bedside. Then we could go in, upload the PDA, and put it all into the computer system where everyone can access it.
And you can take a picture with the device?
Yes, you can.
Wow. Well, why don't you, this is our patient. This is Ted. Ted's going to be joining us today also. And Ted has a horrific sacral ulcer. But before you take the picture, I want to introduce someone else to you. Ann, come on down.
Come on down.
This is Ann Sherrick, and she is Vice President of Clinical Operations at Wound Rounds. And I'm happy that you were able to come in and join us today.
Thanks for having us today.
Well, we're very excited to learn about your device that you have worked so many years on developing, and I'm very excited to see it. So Tamisha's just going to get me started here, and feel free to jump in with anything
I'll do that. Great.
as we
She knows her way around the device. So
I'm sure
we'll
she
get her
does.
started.
Now, how many months have you been using this?
Coming up on 3 months.
Great. Well, sure. Take me through what you would do if Mr. Ted was your real patient today.
Okay, of course, I will come in, I will introduce myself to Ted and let him know that I'm going to be using a wound round device where we'll be doing the assessment at the bedside. Okay, so first I will have to get a measurement of Ted's wound.
And of course, we have to always put on our gloves then.
Of course.
Good nursing care.
Yes. Okay. Now this is his sacral wound. What I would do is I would measure his wound,
Okay.
and once I get Ted's measurements, I would then take the same measuring strip, find Ted in the system, upload the camera, put this alongside the wound, and there we go.
Wow. What a great clear picture.
Yes, it
Are they
is.
always this clear?
Yes, they are.
Wow, that is really nice. Well, yeah, you see them all the time, but look at this. This is really, really clear. And you can actually even see where there's some undermining here on poor Ted. So I'm very impressed that that is so clear. And you, when you're done with your documentation, then this automatically becomes part of the medical record.
Yes, it does.
Wow.
So it automatically attaches to the rest of her notes, so we don't have pictures floating out here and notes floating over here and trying to match up every
So they're
time they do the
all
note.
connected.
All connected.
Yes, they are.
So what else does this magic little machine do?
Okay, once I go in and I save the picture, it also lets me input the tissue type, the measurements, and everything else that needs to be put in place. So I could go in and I can add in all the tissue types, the drainage and everything, and then I just hit save and exit.
You do it very fast, so it doesn't take much time to do this assessment then.
No.
Much better than the old days. You said you've been in wound care for 11 years, so
Yes.
you must have had, like Ann and I certainly have, the old narrative, writing everything out and check sheets.
Yes.
So this kind of beats that, I'm assuming.
And saves time.
And does the staff like it because they can access it?
Yes, they can. Like the nurses who's coming on behind me is able to go in and access what I did for that patient and the picture that I took for that day.
So improving communication between staff, taking care of the patient, means Ted gets better care.
Yes, he does.
Wow, I like that. So what else does this do?
Okay, we can also input Ted's braiding assessment. You go into Ted's braiding, go in, it's a drop-down list of everything that applies. I click all that applies to Ted. I just hit intervention, and there it gives you the braiding score. And then after that, I could go into the intervention page, and it's another drop-down list. Click all that applies to Ted, and there we go.
So it's a requirement here in long-term care that you do a Braden assessment, so you've got that covered. You're really walking through your MDS, aren't you?
Right. So all the data that they need to submit their MDS and long-term care, or the new requirements for the LTACs and the inpatient rehab hospitals, are collected one time and then repurposed. So the person who's responsible for that reimbursement has a worksheet within the system, and all he or she has to do is click a button, and all their Section M questions are answered for them.
Enhances accurate documentation.
And accurate reimbursement
which
for the
means
facility.
accurate dollars for patient care for the facility.
Absolutely.
That is, in this day and age of our economic issues that we deal with, is so very important.
Key
so,
point.
That is really cool. I think one of the great benefits I see is what you were just talking about, the communication between staff and the other wound care nurses.
Yes.
So that you can actually, if I were coming on at 3 to 11 today, I would be able to pull up everything and be comfortable knowing what that wound looked like, so that when I'm doing a dressing change, I can really tell if there's a change to the wound or not.
Yes, it does.
Additionally, because the database is internet-based, anybody can access that database from any computer. So if the physician is at home and they need to share information with the physician, he or she could log in on their home computer and get into the database if they had authorized access. Same thing if Tamisha wanted to consult with her corporate nurse and get some clinical input. That person doesn't necessarily have to be in the building to be looking at the chart. They could be at another building or at their office and access that database. So that communication circle gets bigger and bigger even outside of the facility itself.
I think that's invaluable, especially with the physician. If there is a significant change, you can take a picture and actually have the physician see it immediately.
Immediately. So then that response from the physician can be that much quicker and the care can be improved that much faster.
Well, it really is that what we always strive for is, good care across that continuum.
Exactly.
And involving everybody in the whole team into the care of the patient. So it looks like you guys have done a great job with using the system and creating the system. I'm very impressed. I'm very impressed with the accuracy, the speed, and it really is covering all of the requirements that we have for long-term care, and making sure we get all the bases covered. So legality-wise, it really certainly enhances your documentation. So I want to thank you both very much.
Thanks, Sharon, for coming by.
For being here today.
Thanks, Tamisha.
Yeah, I'm thanks for sharing with me. I had not seen the system live, so I'm really thankful. Thank you both, and thank you, Bronzeville Park, for allowing me to be here with you today.
Well, that was wonderful. I hope you enjoyed that segment of the Workbench. Thank you, Sharon and Tamisha, for that very insightful clinical overview of the Wound Rounds device. However, while we were in Bronzeville, we also had a chance to catch up with Jonette Prince, Director of Nursing at the Bronzeville Extended Care Facility. And she had a few interesting things to say about Wound Rounds as well that we would like to share with you. While we're listening to Jonette, I'm going to go make rounds myself, and I'm going to use the Wound Rounds device. I'll see you later.
What Wound Rounds does for me, it allows me to pull data so that we're able to use it meaningfully in our QA meetings. And that has assisted us in really honing in on our issues with incontinence, gearing us for what we need to focus in on in servicing with our staff to make our position better in caring for residents with wounds. And you're able to really see at a glance where the patient is in terms of progression, healing, stagnation, etc. They have a feature within Wound Rounds that has the ability to project, once the information is entered into Wound Rounds, if residents are high risk. To have universal accuracy and consistency throughout the medical record is the key to decrease litigation. And I think that Wound Rounds sets you up only for success in that regard. So I am very, very happy, as well as my staff, to use it. We have accuracy, we have consistent information, meaningful information, and it's a gold standard.